A warm welcome from the land of diversity, India, to the living legend in endodontics, Dr. Stephen Cohen. I would like to thank Dr. Stephen Cohen for his epitome dedication and contribution to the pathways of Pulp, that many budding endodontics are able to broaden their learning horizon. You have actually taken endodontics to another level. It's our honor to have your presence with us, sir. With my folded hands, I welcome you to India. Namaste. I heartily welcome you all today for this exclusive webinar. I would like to thank the founder and CEO of Cynodent, Dr. Anmol Bagaria, and the team Cynodent for organizing this webinar. First of all, I would like to introduce Cynodent. Cynodent is a unique platform, first time in India, a digital healthcare platform that provides and enhances a good relationship between patients and doctors and also enables a real-time appointment scheduling system. Our goal is to create easy access to healthcare services. Cynodent is here to create precious and healthy smile on our patient faces with minimum effort and maximum welfare. We have also brought research and educational programs for doctors to enhance their knowledge and keep them updated regarding the same. Cynodent is also working for social welfare and humanity to enhance the quality of life, providing healthcare needs, health awareness, and free treatments.
The legend of endodontics, Dr. Stephen Cohen, is ME, D.D.S, F.A.C.D, F.I.C.D, and he is a diplomate of the American Board of Endodontics. He lectures worldwide on endodontics and maintains a full-time endodontic practice in San Francisco's historic 450 Sutter Medical Building. He is the senior editor for all 9 editions of the Definitive Endodontics textbook, Pathway of the Pulp, and a co-editor of the renamed 10th and 11th edition, Cohen's Pathway of the Pulp, and recently he introduced his 12th edition also.
Dr. Cohen served as the chairman of the Department of Endodontics at the Arthur A. Dugoni School of Dentistry, University of the Pacific, and has continued his long relationship with the school as an adjunct clinical professor of endodontics and former director of Endodontic Postgraduate Program at the Riyadh School of Dentistry in Saudi Arabia. Dr. Cohen has held leadership positions in many of the major professional organizations in endodontics and dentistry, including as a director of the American Association of Endodontists and the San Francisco Dental Society, and as a fellow of both the American College of Dentists and the International College of Dentists. Dr. Cohen has authored and co-authored numerous papers for the most significant journals, was co-editor and contributing author of a clinical guide to dental traumatology.
To be inspired is great. To be an inspiration is an honor. Words of wisdom from the living legend in endodontics. Let's learn together, celebrate and elevate craft of endodontics, exploring the canal path with the author of Pathways of Pulp, Canal in and out with the master himself. So, a live session by Dr. Stephen Cohen on the topic RCT root canal treatment for a Bengal tiger. Cynodent welcomes legendary endodontist Dr. Stephen Cohen.
Thank you for your very generous introduction. I would say I've had the privilege of being introduced in many countries around the world. But once again, India has brought it to another level for introduction. So I'm deeply touched. I thank you. And I'll go forward from here to speak about what has already been introduced, root canal treatment for a Bengal tiger. And so I'd like to begin with the traditional greeting that all Indians have, which I use even here in America, because it is such a genuine and heartfelt greeting. So I say to all that are listening, namaste. Before I go into the program itself, I'd like to give a little context to the times. What you're about to see was root canal treatment for a Bengal tiger that was actually performed more than 40 years ago. And so I'm going to say good evening to all the dentists that have stayed up late to watch this presentation from halfway around the world. So in tradition, which I especially enjoy, the Indian tradition of namaste, I say namaste to all my Indian friends and colleagues halfway around the world. I first want to give context to the reason this root canal treatment was done for a Bengal tiger. We have to step back in time because the values, the beliefs about 1975 were very different from what we have now. You could just imagine more than 2 generations ago. And putting it in a different light, if I knew then what I know now, I would not have performed this procedure, because today we have ethics committees, and then we also have to access, considering everything, our moral conscience. Is this a right thing for the right reason? So that being said, back in about 1975, I was asked to do root canal treatment for a Bengal tiger, one of India's treasures, because this tiger was one of the features in a children's zoo. And there was concern by the very cautious authorities that because of his canines, he might be able in a moment to flash and grab a child's arm and tear it off. And so as an abundance of prudence, they requested that if I would remove the canines, which again, under the circumstances, it seemed at that time like the right thing to do. And so with my staff of 3, we went down to this area in Visalia. That's a small city in central California, and working hand in glove, so to speak, with a veterinarian. The veterinarian using ketamine as a general anesthetic was brought him down to a light level. He appears, and certainly is, it's general anesthesia, but it's not deep general, it's light general. And I'll tell the story about this in a few moments. And so we proceeded, once the cat was brought down to this level, to begin to do the root canal treatment, removing the canines. And this is about as close as I'll ever want to get to a Bengal tiger, and only under these conditions. And so first we were able to use the instruments that we would ordinarily use in practice. So a 558 tungsten tip burr was used to literally remove all 4 canines. And actually it took quite a while. It took about 2 to 3 minutes, as I recall, to remove each canine. And it took several burrs because the tooth structure was so thick and seemingly so dense that a burr would burn out in less than a minute. But eventually we got all 4 canines removed. So I'm just holding up one, and my staff, of course, were holding the others, which I'll show later on. So then the issue came up after the canine itself was removed. How do we remove this pulp? Now, all of us, or I think many in this audience, many have already removed pulps several times, perhaps many times. And we all know that it's not that much of an effort. We have certain instruments, small instruments, measured in small fractions of a millimeter to help us remove a vital pulp, ideally intact. Well, I think everyone knows how little effort it takes to remove a pulp that's vital. So here I have a hemostat locked around the coronal third of the pulp. And as I'm pulling on this, the pulp will not dislodge. So after pulling for quite some time, it seemed like it was time to employ a second hemostat. So now with both hands pulling, I got most of it out, but then it still seemed to refuse to come out. It was that long. And so a third hemostat was employed. And then finally, with that third hemostat, you can only imagine the length of this pulp. When the pulp was removed, of course, there was some bleeding, but surprisingly, much less bleeding than I would have imagined. It bled for perhaps a minute, and then the bleeding stopped. And here you can see the length by the ruler, but my estimate is when it came out in total before it became somewhat desiccated, and when a pulp dries up, as we know, it will shrink. So this pulp was already beginning to shrink, but my estimate is that it was approximately 125 millimeters when I removed it. The veterinarian reminded me to keep the mouth moist. He said, very important. So we did this frequently to make sure that that there was no drying of the tiger's mouth. So here we come to the issue of how exactly do we fill a root canal for a tiger when you can see, just looking at this, it's approximately maybe a couple of centimeters wide, to say nothing about how long it is. And when you have something this wide, exactly what instrument would any of us use? Well, the answer is there are no instruments. Everything that I had to do, if there was anything to be done, I had to get from a hardware store. So forging ahead, mixed up several millimeters of zinc oxide eugenol sealer that was used more commonly back at that time. And after the sealer was introduced, first made sure, using just 2x2 gauze, that the canal, that the bleeding had stopped. And we used moist gauze to go as far as we could, extend it into the canal, to clean the walls with a 2x2 gauze wrapped around a screwdriver. As I tell you now, it still makes me laugh, but that actually worked, as you could imagine in your mind's eye. And so this shows you how wide the root canal is. And so now what to do? How exactly, after we've irrigated and just use, in this case, I did not use hypochlorite because there was no telling. I was not sure if there was even a mature apex in this young tiger. So as an abundance of caution, I used just physiologic saline. And I irrigated profusely. I can't remember how much, but I'd say at least 30 or 40 cc's, probably more, of physiologic saline until I could insert 2x2 gauze on a screwdriver down as far as I could go in the root canal and see that it was reasonably dry. It was reasonably dry, and it was not soaked in blood. So once we got to that point, then over a Bunsen burner, got sticks of just plain gutta percha. And as you probably have done in preclinical training, warmed it and rolled it, warmed it some more and rolled it some more until we started to get it into the estimated shape of the root canal from the estimated length of the root canal. And then coated sealer was introduced into the canal with a wide diameter needle on from a large syringe. And I think I put maybe, I'm estimating about 5 or 6 cc's of sealer into the canal, plus generously coating the shaped gutta percha cone. So here the sealer is going in first, of course, and then fitting the gutta percha to the estimated length. And then after it was in there and I could press gently, I did not want to press very firmly. After pressing gently, packing it down while it was still semi-solid, and then for the access opening, placing amalgam. Even in today's times, of course, a bonded composite would be ideal, but under the circumstances, working with a creature like this, amalgam probably would still do the job for its intended purpose. And so I couldn't interpret this very well. I had no experience. Are we okay, Anu? Everything okay, Anu?
Yes, sir. Everything is fine.
Oh, good. Okay, so the veterinarian helped me interpret this for what he knew, and he said, as far as he knew, he thought everything looked just fine. And so now there was a matter of taking care of this sweet tiger to make sure that it did not get pneumonia, that it's like with any patient in the hospital after the surgery, keeping the creature warm until it can gradually recover. And so there was a fair audience for a little town in Central California. This was a big deal for the local television and newspaper. So several people from the community gathered around and wanted to reach in and pet the animal. And so he's still recovering. And the veterinarian is standing there with me as we're looking at each of the 4 teeth. And for science at a later time, I don't know if this will ever be needed, but I thought I should at least photograph this in case it was ever of some importance at a later time. And of course, having 2 sons, I needed a souvenir, as did each member of my staff. So as the tiger continued to recover and no longer needed a cloth over him, this shows how he's being transported back to the children's zoo. Now, here in the States, I don't know if you have this expression, but here in the States, we talk about certain dilemmas that we have and we call it having a tiger by the tail. Well, never in my wildest imagination could I ever imagine that I literally would have a tiger by the tail. But here it is. So it's once a life, and this was my one time. And each staff member got 1 tooth as a remembrance of this unique occasion. And so That's the short story, because you have many excellent professors who will teach you all about diagnosis, cleaning, shaping, obturation, and all the other practical aspects of endodontic therapy. But this is a type of lecture that I think many of you have not seen before. And so I thought it would be of some interest, especially since a Bengal tiger is one of India's treasures. And so it's always a pleasure for me to return to India. I wish I were there with you, because I had an extraordinary experience when I visited there about 10 years ago, I estimate. It was a wonderful time. My wife and I still speak of the experience. And to all of you, I wish you well as you step forward into the future. And if you have any questions, if there's anything you want to ask in case we run out of time here and now, you can see my email address below, and you can contact me directly. So that concludes my presentation.
Surely, sir, it is a inspiring webinar, and thank you so much, sir, for this precious time, sir. And sir, actually, we just have some questions. Uh, I just want to know, I just want to know that what kind of a training do we need to perform RCT on animals, sir?
To perform root canal treatment on animals?
Yes, sir.
Here in, I know we have it in the States, and we may have it throughout North America, but we have an American, I can't think of the exact title for it, but we have an American Veterinary Dental Association or something of that nature. And it's a very important organization, because creatures, large or small, do need our experience. They too suffer from toothaches. And
Yes,
for
sir.
those poor creatures who do not get treatment, some of them die literally from dental infections. So the more we could learn about doing root canal treatment for creatures, the better we'll be taking care of the other creatures. We are their shepherds, and we need to take care of them. My son, who is a board certified endodontist, he too had an experience as I did, but never with a tiger. But he took care of a zoo in, I think it was Oakland. And at that time, he got to do root canal treatment for bears and other creatures of the zoo. And for him, it was a wonderful experience. So I urge all of you, if you have the chance, the opportunity, and the time, perhaps contact your local zoo or wherever they take care of creatures. See what you could do to help them, because they also need our help.
Sure, sir. Sure, sir. Thank you, sir.
Thank you, sir. Thank you so much, sir, for your time. Sir, since we have got you here, we have some questions regarding basic endodontics also.
I'm sorry, I barely heard your question.
Sir, I just want to ask something regarding general endodontics other than the tiger. Sir, I wanted to ask that using nanoparticles to disinfect the canal have been proposed in the recent times. So, what is your opinion on that?
My opinion on what?
On using nanoparticles as an irrigation protocol
On
on
using
irrigation protocol.
antibiotic? I'm sorry, I think we spoke over each other. It's one of the problems of Zoom. But was it about using antibiotics?
No, sir, using nanoparticles in irrigation
Or
protocol.
nanoparticles? I
Yes,
think
sir.
it's a brilliant idea. And I would count on someone just like you to explore that, because I'd love to know the answer. But by all means, nanoparticles are the wave of the future. I encourage further investigation to see about application.
Thank you so much, sir.
And so,
Thank you, sir.
yes, doctor.
Hello, sir. Sir, being a pediatric dentist, I really want to know that what is the ideal irrigation protocol for young permanent teeth?
What is the protocol for what? I couldn't make.
Ideal irrigation protocol for young permanent teeth during performing RCT.
Not about tigers, but about
So,
humans.
yes, sir. Human beings.
Okay. Based upon what we know today, sodium hypochlorite still stands as #1 for irrigation. Now, what you will read, and you probably have already read about different temperatures and different concentrations of sodium hypochlorite. And it's hard for dentists to really get a grasp of what is best for this reason, because the design of the investigations varies so much. It's like trying to compare two things that don't quite fit. So is there any consensus about what is best? So based upon what I'm aware of, I would say at this point to use sodium hypochlorite at least 2.5% in strength, at least. Stronger is fine, but I think anything less than 2.5%, although effective, it would be measurably less effective than 2.5 or greater.
Okay, sir. Thank you.
I want to add one more thing. Be careful about using chlorhexidine along with sodium hypochlorite, because I think many of you know that there's a crystalline precipitate when those two are mixed together. So chlorhexidine is excellent. It's almost as good as sodium hypochlorite. The only real difference is that it will not dissolve tissue. But in terms of disinfection per se, it's equally effective to sodium hypochlorite.
Okay, sir. Thank you, sir.
Last question for today. We have a last question for today. Dr. Anu?
Hello, sir. Sir, recently you shared a post about intracanal cryotherapy. So, sir, will you be adding this intracanal cryotherapy as one of a treatment modality to Cohen?
Cryotherapy?
Yeah.
Yes, I think cryotherapy sounds like a very promising technique. And if we step back, we all know, we've all used cryotherapy, even in our early years. When you got a cut or something was bleeding, what's the first thing you did? Cryotherapy. And so here we're just taking basically our shared experience and applying it to root canal therapy. I think there's much to be said for it. For example, we all have cases where there appears to be excessive bleeding from a root canal. Well, that's where cryotherapy could be quite beneficial. Additionally, it's published something I put on Facebook, I think last week,
Yes.
using cryotherapy for irrigation. In other words, very cold hypochlorite, as an example, actually reduces the patient's experience of pain up to 24 hours later.
Yes, sir.
So I think we have time for maybe one more question, and then I'll help you get on and get some sleep. You're up late.
Yes, so we have the time difference. There's morning here, it's night.
Okay.
Any more
So
questions we have today?
Thank you so much, sir, for this lovely webinar. Sir. Thank you so much. Sir.
it's my pleasure. And to all of you, I say God bless you all as you go forward into the future, and feel free to contact me if any questions remain. So for now, I'll wish you well, and we'll stay in touch along the way.
Sure,
Yes,
sir.
sir.
It's an honor, sir. It's an honor.
Thank you, sir. Thank you so
Thank
much.
you, sir.
Thank you so much, sir.
Thank
My
you, sir.
pleasure. Bye-bye now.
Namaste, sir.